Hi everybody, my name is Dr. April Batchelor. I'm the medical director at CCRM Minneapolis. IVF is in vitro fertilization, so what that really means is you grow eggs inside a woman's body. They're removed using a transvaginal ultrasound with a needle, using the ultrasound as a guide, and then the eggs are placed in the IVF lab under the care of an embryology team where they are fertilized with sperm, and then embryos are grown in a culture system, and that's the in vitro portion of the IVF. So from there, then it really depends on the patient and physician what's been decided to do with the embryos within the culture platform. I think the most common misconception is that it needs to be all-encompassing and that it is like an intimidating process. You know, I really think that you could view the IVF process as 10 to 12 days of devoting to egg growth, and from there you leave it with the embryology team. So, you know, it doesn't need to be as big of a time commitment or as large of a hurdle as I think some patients view it to be. You know, I think probably one of the best things to do is to connect with your provider and their team. You know, if you've got questions that are specific to your particular circumstance, you really want to connect with the people who know you best. I think it's really easy for folks who are in these support groups and chat groups to get kind of drawn into things that can feel really quite scary. And I think it's important to keep in mind that your personal circumstance is really yours and not, you know, your friends. And so the best thing you can do is connect with the people who know your medical circumstance best, and that's going to be your physician and their team. No, that's very 90s, and although many things in the 90s seem to be coming back, that is not the case in IVF. So really now we've done so well within the IVF space at creating high quality embryos that the success rates in an elective single embryo transfer now approach 70% in many cases. And so really you don't improve your pregnancy rates by transferring multiple embryos at once. We really want to emphasize that. So the best thing you can do is to do one embryo at a time, an elective single embryo transfer. That is your best chance for a healthy baby in most circumstances.